What is this situation? In this situation, the running person away from the dog is in fearful condition. He wants to preserve his life. His eyes are accommodated to far vision. His heart rate is increased, and he wants to preserve his life, and he's spending lots of energy. Bottom line, this is an increase in the sympathetic activity. Sympathetic system is part of the autonomic nervous system. The autonomic nervous system has two parts: sympathetic, spending energy away from danger, and the parasympathetic is rest, and like a person is in a sleep. This is another example of a fearful person where the sympathetic activity is at its maximum, and when the sympathetic activity increases, the parasympathetic is going to decrease. So these two components of the autonomic nervous system are in balance. This PowerPoint presentation is going to deal with the sympathetic system. The sympathetic system has two components. Number one is a central part, and number two is a peripheral part. The next question is, what is the highest brain center controlling sympathetic activity? The answer is the hypothalamus. It is the main central part of the sympathetic system. It receives influence from the cerebral cortex. The limbic system also influences the hypothalamus. The limbic system is dealing with afferent endocrine feedback. It is about emotion, motivation, and memory. What is next is the reticular formation. Reticular formation is an important part of controlling the sympathetic part of the autonomic nervous system. Reticular formation is containing centers for vasopressor and dilator of blood vessels, and it also contains cardio accelerators and decelerators centers, in addition to centers for respiration. All these factors in the reticular formation will affect the hypothalamus. What is the hypothalamus going to do? It is going to send descending tract called reticulospinal tract, which is going to the spinal cord. In the spinal cord, there are two reticulospinal tracts. There is the lateral reticulospinal tract and the medial reticulospinal tract. Next question is, where do these tracts end? This is a cross-section of the spinal cord showing the edge-shaped gray matter and the white matter, the folliculi, and the beginning of the spinal nerve. Now, the spinal cord is going to receive reticulospinal tract, and the reticulospinal tract is going to end up in the lateral horn of the spinal cord. Where do I find lateral horn? It is from T1 to L2. So the first order neuron is going to end in this lateral horn containing cell bodies. What is next? This lateral horn cell is going to send an axon, and this is a preganglionic neuron cell body. So now we are going to leave the central part and go to the peripheral part. Axons of these cells will travel ventrally along the ventral root of the spinal nerve, and because these are myelinated, these leaving axons are called white rami communicantes. The peripheral part of the autonomic nervous system, as you can see in the lower figure, it is made of two neurons. There is the preganglionic neuron coming from the lateral horn to a ganglion, and it synapses in the ganglion and send a post-ganglionic axon to the effector organ. So this is the arrangement of the sympathetic system, in contrast to the somatic nervous system, where the anterior horn cells will send its axons to the effector organ without an interrupting presence of a ganglion. Here is what is happening to the white rami communicantes. Here is the cell body in the lateral horn. It is going to send an axon which is myelinated, therefore it is white, called white ramus communicantes. It leaves through the ventral root of the spinal nerve, and then it is in the spinal nerve. Then this is what happens. It is going to leave the spinal nerve, and when it leaves, it is called the white ramus and enters a ganglion, one of several ganglia of the sympathetic trunk. And one of the possibilities is that it synapses with the cell body of a neuron in the ganglion, and this ganglion, this neuron in this ganglia is going to send an axon back to the spinal nerve, but this axon is not myelinated, therefore it is called the gray ramus, and then it gets distributed to the targets through the spinal nerves. Again, the same plan of the peripheral part of the nervous system, but of different scenario, different events. Is the lateral horn. This is the cell body of the neuron which is going to send its axon as white ramus, and the axon is going to lead through the ventral root to the ventral efferent fibers of the spinal nerves, and then it joins the spinal nerve. It leaves the spinal nerve as white communicating ramus, and then we have a ganglion. There are different possibilities that will happen here in the ganglion. Possibility number one is that as in the general idea of the system, it is going to send gray ramus back to the spinal nerve. The other scenario is that this white ramus is going to go up to other superior ganglia, and either it synapses or it doesn't. Then there is a possibility of going to inferior ganglia, 1 or 2 or 3, to behave the same way as in this ganglia. The other thing is that this white ramus is going to leave the ganglia without any synapse, and it goes to another sympathetic ganglia, but it is not on the side of the vertebral column, meaning not to the what's called paravertebral ganglia. It goes to ganglia in front of the vertebral column. Therefore, it is called prevertebral ganglia, and these are usually present in the abdomen. So these are the possible scenarios that will happen when a white ramus leaves the spinal nerve and gets into a sympathetic ganglion. Another example of the same story. Here is the white ramus going out of the spinal cord through the ventral ramus of the spinal nerve, gets into the spinal nerve, leaves the spinal nerve as white rami, which are prior to entering the ganglion. Therefore, it is called preganglionic. Enters the ganglia, synapses, and then it goes up back to the spinal nerve as gray, non-myelinated, or it leaves the ganglion without doing anything and end up in the prevertebral ganglia. These fibers that take no action in the ganglion and then they leave and go to the prevertebral ganglia are called splanchnic nerves. Here are the notes about parts of the sympathetic nervous system. The sympathetic nervous system has central parts and peripheral parts. The central parts include the brain. Which parts of the brain? The hypothalamus and the reticular formation, taking influence from other brain structures. Then spinal cord. Which parts of the spinal cord? First of all, we have the descending reticulospinal tract, and then which is going to end in the lateral horn of T1 to L2. So these are the central parts. What about the peripheral parts? First of all, white rami communicantis leaving through the ventral roots of the spinal nerves, and then we have the ventral rami of the spinal nerves. Next is paravertebral sympathetic ganglion, and then gray rami communicantis coming out of the ganglion and leaving to join the spinal nerve again and going to the target organs. This is one of the scenarios. This is the most common scenario. What is the next question? What are the target organs? answer is look into this rectangle. It is from head down. The iris, the ciliary body, salivary glands and lacrimal glands, lungs, heart, most of the parts of the gastrointestinal tract and the urinary tract. One of the targets of the sympathetic nerve system, the peripheral part, is blood vessels. When there is a high rate of firing of impulses of the sympathetic system, the smooth muscles of the wall of the arteries will lead to vasoconstriction. When there is low rate of firing, the smooth muscles will relax and there will be vasodilatation of blood vessels. No parasympathetic supply to arteries. Next question. What is the sympathetic outflow? What do we mean by sympathetic outflow? We mean how it's going to change from the central part to the peripheral part. And it is going to be the T1 to L2. This is the place where the peripheral part of the sympathetic nervous system is going to come out of spinal cord. These segments, what do they have? They have lateral horn. And these lateral horns are going to give access to leave spinal cord. When we say T1 to L2, what about another name? It is called thoracolumbar. Although it is mainly thoracic, but few lumbar, but it is called thoracolumbar outflow. If it starts at T1, what about the cervical segments of the spinal cord? These segments, the cervical, they do not give outflow of the sympathetic nervous system. Neither the brainstem or the brain, neither the sacral segment and the lower lumbar segments. So it is only T1 to L2, it's only thoracolumbar. Next question is what? What comes out of the spinal cord? What is the outflow made of? The answer is preganglionic neuron in the lateral horn will send its axon to leave the spinal cord. This axon coming from the lateral horn cells are myelinated and therefore they are called white rami communicantes. What is next? This is an example of one segment leaving the spinal cord, but going where? It is going to a ganglion on the side of the vertebra, and this group of ganglia is called sympathetic trunk. What is next question? This is the classical outflow of the sympathetic system. What about cervical segments? Cervical segments don't send white rami. How do we have sympathetic ganglia in the cervical region? The answer is yes, we do. And do we have sympathetic ganglia below L2? The answer is yes, we do. How do they receive their white rami? They receive it from the upper thoracic ganglia, and the lower ones, they receive it from the lower lumbar ganglia. So, are all ganglia of the sympathetic trunk receive white rami? The answer is yes. From T1 to L2 directly, but from cervical region and the lower lumbar and sacral, they receive it indirectly from upper or from lower ganglia. Next, what is the question? The answer is white rami communicantis end up in ganglia of the sympathetic trunk of T1 to L2. Plus, what do they do in a ganglion? They synapse, and the result is postganglionic axon. Now, for the cervical part of the sympathetic trunk, after synapsing, how are they going distributed? Because lower down they are distributed by spinal nerves. Is this going to happen in the cervical region? The answer is no. Postganglionic fibers, they travel with what? They travel with blood vessels to different organs. That is a different way for postganglionic fibers to travel. And they come from the upper thoracic segments, and they travel through blood vessels to the eyes, salivary glands, lacrimal glands, and other target organs. Now, there is a scenario that says that white rami, they pass through the ganglia. They do not go up or do not come down. They leave the ganglia without synapse, and then they go out of the sympathetic trunk to reach another group of sympathetic ganglia, which are not paravertebral but prevertebral. And T5, 6, 7, 8, and 9, they make the arrangement of splanchnic nerves. And this is the greater splanchnic nerve, which is going to end up in the celiac ganglion. Then there is T10, T11, and T12. This is the lesser splanchnic nerve, which goes to the superior mesenteric ganglion. And then the least, which is L1 and L2, they go to the inferior mesenteric ganglion. This is an image of the three cervical sympathetic ganglia, superior, the middle, and the inferior. They are posterior to the carotid sheath. This is a diagram of the vertebral column showing the paravertebral ganglia of the sympathetic trunk, and there is a connection between a ganglion and another. This is made by the either the gray or white rami that will go up and down few ganglia. Then we have a white communicantes that are leaving the ganglia without synapsing, and they go to the front of the vertebral body and they form splanchnic nerves. One of the facts of the sympathetic system that differs from the parasympathetic is that the sympathetic outflow goes to blood vessels and the adrenal glands, while the parasympathetic don't reach these organs. This is a freshly dissected cadaver where you can see the superior cervical ganglion at the upper end of the sympathetic trunk, and this is the middle cervical ganglion, and here is the inferior cervical ganglion, or it is called the stellate ganglion. As you can see, the distance between these three ganglia is much longer than the ones of the rest of the sympathetic trunk. The yellow marked structure is the cervical part of the sympathetic trunk, showing the three ganglia and the connections between them. Here is a closer image diagram of the inferior cervical ganglia. Here you can see the middle one, then the inferior one is called stellate ganglia. It has a special arrangement. It has a loop that the vertebral artery will go through, and sometimes it is fused with T1 sympathetic ganglion. Here's a diagram showing, first of all, the diaphragm between the thoracic cavity and the abdominal, and these are the roots of splanchnic nerves, the greater one, and here is the root of a lesser splanchnic nerve, and then the least. What they do is that they pierce the diaphragm and they reach the celiac ganglia, which are around the celiac trunk, and produce a plexus called celiac plexus. Spinal cord and has connections with the sympathetic trunk, T5, T6, T7, T8, T9, T10, T11, T12. T5, T6, T7, T8, T9, they form the greater splanchnic nerves, one on the right and one on the left. They pierce the crura of the diaphragm and they go to the celiac sympathetic plexus around the celiac artery and form the celiac plexus, which is going to supply most of the parts of the gastrointestinal tract, plus the renal plexus around the renal artery and the suprarenal medulla. They receives pre-ganglionic white rami, of course, because they are splanchnic nerves. And the post-ganglionic is a cell secreting hormone. This is what happens in suprarenal medulla. It receives pre-ganglionic, and the post-ganglionic is a hormonal cell, secretes adrenaline. This is most parts of the gastrointestinal tract supplied by celiac plexus. What is this image telling me? It is telling me that again, greater splanchnic nerve and the lesser, they go to the celiac ganglion tract. This is a group of images showing the sympathetic trunk in the thorax. This is a dissected cadaver in which the lateral chest wall has been removed, and one can see the yellow marked structure is the thoracic part of the sympathetic trunk. This is an important image. If you look at the thorax and the abdomen and the pelvis, you can see that it is greatly filled with the sympathetic and the parasympathetic nervous system. So the autonomic nervous system is filling the thoracic, abdominal, and pelvic. Now, the lesser splanchnic nerve is going to feed the inferior mesenteric ganglion, which is supplying the distal part of the large intestine. The cervical sympathetic ganglia will supply target organs and reaching them through blood vessels, and they target the eye, salivary glands, the heart, and the lungs. This is the typical distribution of referred pain from the heart, involving the side of the face, the neck, the pectoral region, and the inside of the arm and the forearm. When pain takes place in the heart, it is the afferent part of the autonomic nervous system. So the autonomic nervous system has an afferent or sensory part. It is not only an efferent effector system. Here is the story of pain coming from the heart. When angina or anoxia of the myocardium takes place, pain is going to be produced. It is carried out by the sympathetic nervous system. Then it is going to reach the dorsal root ganglion, like the somatic sensation, and pain from the skin is coming through the same way, through dorsal root ganglion, and they end up in the dorsal horn of the gray matter of the spinal cord. Now, why deferred pain takes place? One of the acceptable theories is that depend on firing impulses. If the impulses coming from the heart are so frequent and strong, they overflow to the neurons, bringing the pain from the pectoral area, for example. And we have to underline overflow. So pain will be felt in the skin, and the original pain is coming from the heart.